Let's talk about these COVID-19 cases popping up in schools. Seems like almost every day we get a handful of emails about another student diagnosed with COVID-19. So here's the deal. With more students back in classrooms, these cases are pretty much inevitable. But it's how schools handle them that can make or break the future of the fall semester. So for tonight's big story, we hear from a nurse who handled one of our state's first student cases. The state school superintendent shares one of the biggest struggles schools now face in containing the coronavirus, and a family preparing to make a huge sacrifice to keep their children safe. But we want to start tonight with our Alan Carter in Hancock County.
Months before the start of school, Heather Barnett and her nursing staff at New Palestine Schools were preparing.
Infrared, no-touch digital thermometers. We have hand sanitizer, our gloves.
She says they were ready, but certainly didn't expect to see their first case of COVID-19 so early.
We weren't expecting it so soon, but I think it's one of those things that until you actually do it, you don't know how it's going to go.
Monday, the first day back, Barnett says she was notified a student at the high school had tested positive.
I was not nervous. It was just kind of like, okay, here we go. We have a plan in place and we can do this.
Here, anytime a positive test is reported, or even if symptoms are suspected, students or staff are immediately isolated.
So these rooms are individual rooms and they're all locked right now, but they are clean and sanitized and ready for a kiddo to go in.
And this year especially, schools aren't taking any chances.
You know, now we have kiddos that come in with allergy symptoms or cold symptoms, and those mimic COVID symptoms. So we're sending children home for things that we didn't necessarily have to in the past.
It's a little bit scary right now.
Deborah Robarge is the director of the Indiana Association of School Nurses.
We are the public health person in every school. We're the only health professional in every school. So I think this whole epidemic, like I said, has pointed out how crucial we are.
Now we know preventing a COVID-19 outbreak at schools does not stop at the nurse's office. After a student tests positive, it's then time to pick up the phone and start calling parents. But the state school superintendent says that may be harder said than done.
More than 1 million children attend Indiana's public schools. According to the superintendent of public instruction, they are adjusting better than expected to face masks and social distancing. But there have been some problems. Dr. Jennifer McCormick said contacting the parents of some students who may have been exposed to COVID-19 by another student has been difficult.
Schools are doing the best they can. They've planned, but until sometimes you get thousands of kids come through your door, things change.
But change doesn't come easily. Some school districts are seeing an increase in teachers retiring or leaving the profession because of the pandemic.
Now, on top of all of this, there's the problem for parents deciding whether it's riskier to send your kids to school or keep them home. Now, we know children usually don't get as sick from this coronavirus, but they can be secret spreaders, passing the virus on to other people without even knowing it. And that can lead to someone else getting seriously sick. But tonight, our Emily Longnecker shares the other side of this struggle as one family finds themselves stuck in an impossible situation.
The school year hasn't even started yet for Adam and Amanda Moore's twin boys, Baden and Jackson. And already these parents feel like they're in an uphill battle.
We're really overwhelmed with it all. And we don't know what to do.
It's a waking nightmare.
I spoke with Amanda Moore several months ago about getting through a pandemic.
He says OT, his PT, his speech.
When your child has special needs. The Moore's son Jackson was born with a rare neurological disease called Angelman syndrome and needs daily therapies, something that wasn't happening during the early weeks of the shutdown. Now the boys are set to start kindergarten next week, all of it online, after their school district, Hamilton Southeastern, decided to go to all virtual classes, at least until Labor Day. Other school districts have made similar moves as COVID-19 cases in Indiana started to climb again.
Zoom meetings and online teaching for kindergartners is I don't know.
I understand why we're not going back and the importance of keeping people safe. But when it comes to individuals like Jackson, what are we going to do?
The likely answer is that one of these parents will probably have to quit their job to help the kids with school if classes stay virtual for the long haul.
Even if I were to stay home, I don't know if I'm equipped well enough to get Jackson what he needs.
Neither option feels like the right one. Send the kids back to school and worry they'll get sick, or someone quits work to stay home and teach, something neither is trained to do.
Every single night, Adam and I look at each other and we're just like, I mean, what do we do? And we're just living literally hour by hour at this point.
With more students returning to school, the latest number of COVID-19 cases is not what we want to see. Yesterday, look at this. We had more than 1,000 Hoosiers diagnosed with COVID-19. That's the first day ever that we've broken 1,000 cases in a single day. And another unfortunate milestone we're watching here in Indiana, the number of people now in the hospital, and that number also broke 1,000. We haven't seen numbers that high since the end of May. Now, we know children account for a small portion of those hospitalizations. We've got 120 kids in the hospital right now with COVID-19. But tonight, as we wrap up our big story, we want to remind you of those CDC guidelines, helping parents maneuver through these new COVID-19 risks. You can find a link to them on WTHR.com/coronavirus.